Hello, dear listeners. Today you will understand how a heart attack occurs, how to recognize a heart attack, and how to provide first aid properly to maximize survival chances. Many different terms refer to an acute heart attack: myocardial infarction, angina pectoris, acute coronary syndrome, etc. However, usually they mean the same condition and require the same first aid actions. A heart attack begins when one of the vessels is blocked. The block can be caused either by a clot or a cholesterol plaque or a combination of these. As a result, the heart muscle stops getting enough blood and therefore oxygen. However, the heart muscle keeps working, contracting with a lack of oxygen and nutrients. That leads to the partial death of the heart, and only proper help can save the victim's life. How can you recognize a heart attack? You need to know 3 signs, and if at least one of them is present, you have to call an ambulance immediately. The first sign is a pain in the heart area. Usually the pain is manifested during physical activity and is characterized by pain in the chest. During the rest period, the pain syndrome is partially eliminated. Typically, the victim complains of the pain in the chest central part, behind the sternum, or in the upper body's left side. The pain usually has a wide area without clear boundaries. A person cannot localize the pain, cannot point to a certain area and shows it with his whole palm or fist. Heart pain may also appear on the left side of the body: shoulder or forearm, scapula, left half of the neck and lower jaw, upper abdomen. Victims describe the pain as sudden, burning, and squeezing. The second heart attack sign is dyspnea. As a rule, it is a lack of air, frequent shallow breathing, sharp weakness. The third sign is pale skin and cold sweat. There may be nausea, heartburn, or pain in the upper abdomen. Often these signs appear along with chest pain, sometimes followed by it. A typical heart attack usually develops in some time after physical or psycho-emotional stress. Cold, windy weather, stressful situations, smoking, and even overeating can provoke a heart attack. However, chest pain may be related not only to the heart, but also to the musculoskeletal system, digestive organs, abdominal cavity, and lungs. Stabbing, shooting chest pains, which last for many hours, do not change their intensity, but changing the nature with body turns, pressure, and deep breathing, usually do not need emergency treatment. They are manifestation of musculoskeletal system diseases. So let's talk about your actions to maximize the victim's chances for survival. If you see someone with the signs of a heart attack, even with a mild intensity, which lasts more than 5 minutes, try to calm the person down. Do not hesitate and immediately call an ambulance. Do not wait more than 10 minutes, it can be dangerous for life. If you have symptoms of a heart attack and cannot call an ambulance, ask someone to drive you to the hospital. It is the only right solution. Never drive by yourself, except in the absence of any other choice. Anyways, the first aid algorithm is the following. If the attack has developed during physical activity, including walking, you must stop the action. A person should sit down, preferably in a chair with armrests, and lower his legs. The aim is to reduce the load on the heart. So, do not insist on a particular position. Let the victim choose how it is easier for him to breathe. It is crucial to provide fresh air access, open the window, unbuckle the collar, and untie the belt. If you suspect a person has a heart attack, give him 0.5 milligrams nitroglycerin under the tongue. Do not swallow. Then give him 0.25 grams of aspirin, which should be chewed. If the pain has completely disappeared and condition has improved, call a family doctor and follow his instructions. If pain persists 5 minutes after taking the medicines, retake nitroglycerin and call an ambulance. If the pain persists 10 minutes, you should take nitroglycerin for the 3rd time. If medicine overtaking caused weakness, sweating, shortness of breath, lie the victim down, lift his legs, let drink a glass of water and wait for the ambulance. So once again, the dangerous signs: pain in the chest or other parts in the upper body, in the left hand, jaw, neck, back, abdomen. Dyspnea, feeling of lack of air, cold sweat, nausea, dizziness, unexplained weakness or fatigue. In case of any of these signs, call an ambulance immediately or take a person to a hospital. Help the person to calm down and relax. Put the person to a comfortable position. Give the person his medication if he asks. Do not give any medicine of your choice. Watch his breathing and consciousness. It is strictly forbidden to patient with a heart attack to stand up, walk, smoke, or eat until special permission from a doctor, and take medicines in allergy of personal intolerance. Let's summarize the video. You have learned how a heart attack develops, how to recognize a heart attack, and how to provide first aid to maximize survival chances.